Go ahead.
Oh, hi, my name is Deidre Swanson.
And I'm Ava Sitlow, and we did our project on ischemic heart disease relationships with universal health care. Um, to get right into it, we're going to go over to our abstract. So, our focus for the study was ischemic heart disease, or IDH. It's a leading cause of death worldwide, and access to healthcare plays a major role in the prevention, early diagnosis, and treatment of this disease. So, our study explores this relationship between IDH and countries with universal healthcare versus countries without universal healthcare. So we use secondary data to compare. For this study, we compared data from universal healthcare systems in some countries to countries without universal healthcare. And we looked for differences in mortality rates of people with IHD. So our findings showed that there was a major difference in mortality rates between countries with universal health care. They had a lower median mortality rate of 79.5 per 100,000 people, while countries without universal health care had a median of 279.7 per 100,000 people. So these findings suggest that universal health care will contribute significantly to better heart disease outcomes with more access to care, and that could include prevention and early intervention. So, for the background, um, IHD was a leading cause of death in 2021 and has been responsible for 13% of the world's deaths since 2000. So, studies have shown that the impact of lack of healthcare coverage and access, specifically for this disease in the US, shows a higher prevalence of adults with um, of a higher prevalence of adults who did not have healthcare coverage and their association with IHD mortality rates. So this study reinforced the notion that the lack of access to healthcare does contribute to poor IHD outcomes. So this led us to our research question, which was, is there a relationship between ischemic heart disease mortality rates in countries with universal health care and those without?
Okay, so to jump into methods, this study had a descriptive research design utilizing secondary data and doing an analysis from two different data sets, and it was conducted in a desktop-based environment, also just virtually. The sampling strategy wasn't much of a sample, but it really involved using all of the countries that had complete data within those data sets. Countries with missing or null values were excluded during our research. The two data sets that were used were countries with universal health care from the WHO World Population Review and the cause of mortality data set from the OECD, which is the Organization for Economic Cooperation and Development. The initial list of world's countries was downloaded into Excel format, and we merged it with the population review, and then we identified countries that had universal health care. The combined data set was cleaned, it was formatted, we removed duplicates, and we coded each country with a yes or a no to indicate the prevalence or the absence of universal health coverage. And then it was integrated with the standardized mortality rates that was obtained from the OECD. So we decided that we would average the mortality rates from 2018 to 2020 to account for limited data availability from 2021 onward. Countries with missing data were excluded from the final analysis, and the study was reviewed and approved by the IRB of the College of St. Scholastica. Means, medians, and standard deviation calculations were all used for the statistics. So the results, The results showed that countries with universal healthcare systems have a significantly lower and more consistent IDH mortality rates. The median mortality rate for these countries is 79.5 with a mean of 89.58 and a standard deviation of 49.05. And these figures suggest that the IDH mortality rates are relatively stable across countries with universal healthcare. And this indicates that widespread healthcare access may contribute to more consistent health outcomes. So in this context, lower mortality rates indicate better health outcomes as they reflect a reduction in preventable deaths due to improved medical care, early detection, and disease management. So in contrast, countries without universal health care exhibit a higher and more variable IDH mortality rates. The mean mortality rate in this group is 279.7. The mean is 233.44 and a standard deviation of 106. So this is definitely widespread variation, and that suggests that a very small number of countries within this category experience disproportionately high mortality rates. And in this context, high mortality rates points to worse health outcomes. And this could likely be driven by limited or inequitable access to healthcare services, which hinder early prevention, diagnosis, and treatment of IHD.
So, for our conclusion, first, our summary. Our study shows that there is a strong association between countries with universal healthcare systems and lower IHD mortality rates, while countries with without universal healthcare systems show higher IHD mortality rates. So these findings support the initial hypothesis of our study, which was that countries with universal healthcare systems improve public health, specifically in relation to heart disease. And then for the limitations, the analysis was constrained by the available secondary data, and it's important to account for cross-national variables like cultural norms, dietary practices, and poverty rates as well. Oops, there you go.
So recommendations for future research. We would recommend that future studies narrow their focus to countries that are more similar, maybe socioeconomical and cultural contexts. So by controlling variables such as healthcare infrastructure, public health, literacy, income inequity, researchers can better isolate specific effects of healthcare system design on cardiovascular outcomes. In our conclusion, the results emphasize the potential of universal healthcare to enhance public health and reduce preventable mortalities such as ischemic heart disease. These findings lend strong support to policy efforts aimed at expanding healthcare access as a means of addressing global health disparities. And our references here for this poster presentation were WHO top 10 causes of death and a journal entry, ischemic heart disease mortality.
And then here is our contact information. And I'm going to do my best to link our paper and a PDF link to our poster as well in our YouTube video description. So thank you for watching.